All right, let's talk about advanced directive. Very important. I want you to pay attention to this. It's on the NCLEX exam, advanced directive. Now, what you want to know about advanced directive is this. I want to break advanced directive so that you don't forget about it. Now, let's talk about people involved. We have the client. So let me put the client. We have the family member, uh, loved one, spouse, right? Anything you want to call it, right? So we have the durable power of Anthony or healthcare proxy. We have the nurse OS. We have the healthcare team. We have the healthcare team, and we have the ethical committee. All right. So these are people involved in advanced directive. So type of advanced directive, we have your living will. Right. That's a paper document. You have your DNR or DNI. So that is do not resuscitate, do not intubate. And this is the third one. Durable power of attorney or healthcare, healthcare policy. Right. So yes, that's what you want to know. Now, there are two things involved when it comes to advanced directive. NCLEX can test you during admission or care. So admission or either care and care. Right. So that's what you want to know. Now let's talk about admission now. During admission, clients can request for advanced directive, or you might ask the client, do you have an advanced directive? And they tell you no, or they tell you yes. Now, this is how NCLEX can give you the question. NCLEX can say, um, the client is a client is worried about the kind of care they will receive when they can't make decisions for themselves. Automatically, you can see the scenario, right? NCLEX is trying to send that signal to you that we are thinking about asking the client to do what? Advanced directive. Right. So we are going to educate the client about advanced directive because that is what they need. Right. That's what they need to like state the kind of care they want when they cannot make decisions for themselves. Right. So NCLEX can just give you the condition of the client, and tell you their concern. Maybe they are worried about the kind of care they will receive when they can make decisions for themselves. Or the NCLEX will give you the condition, and the NCLEX will tell you the patient have an advanced directive. Right. So now, when they are trying to they are concerned about the kind of care they will receive. You want to educate them about advanced directive. You don't obtain advanced directive. Now, understand this. As a nurse, you don't obtain. NCLEX is going to put this as your answer key. Right. You don't obtain an advanced directive. When the patient wants advanced directive, aside education, all you want to do is to report or let the doctor know about that. You understand? It's the doctor that is going to obtain. Right. People that are involved in advanced directive is the doctor and the legal team. The doctor obtain it, the legal team notarize it. Right. So that's what you want to know. So when the patient is concerned, you educate them about advanced directive and you let the doctor know about it. You don't obtain. So don't select this answer on the exam. Also, if they don't have advanced directive, it's their duty to, or is their right. So you need to tell them about it. So you need to educate and then let the doctor know, and doctor will take it from there. Doctor will start obtaining. Right. So doctor will now walk them through the process of the either the healthcare proxy, the durable power of Anthony, living will, DNI, so DNR or DNI. So that's the doctor duty. NCLEX is only going to test you about nursing duty. The mistake a lot of students do on the NCLEX exam is that they pay attention to everything on the question. There are some things that belong to the doctor, there are some things that belong to the nurse. The NCLEX is testing you as a nurse. So never involve yourself in any answer that involves the doctor. Stop even thinking about it in the first place. The moment you know that answer belongs to the doctor, ignore the answer totally. Right. So yes, a lot of students just like to think everything in the answer key. Always know your scope of practice. Anything that you know is not your duty, don't select the answer. Don't think about it. Don't ask yourself why is the NCLEX including it. The NCLEX also tests the fact that you know your scope of practice is on the NCLEX content. That is how they try to trick you. So it's not a trick, it's something you should know. So yeah. Now, we know about admission, right? Our duty is to educate. Now, so while we are educating, we are also involving what? The family member, be it the family member, the loved one, the spouse, anything you see on the NCLEX exam. The reason why we are doing that is because this um the point of educating and involving the family member, at that point, that is when you can minimize conflicts that occur during advanced directive, right? Or care with a client who have advanced directive. That is when you can start minimizing that conflict, because when the client, right, and the family member or loved one can make shared decision together, right, then anything that happen later on and we need to respect that advance directive, nobody is complaining, right? You understand? So it always involve the family member. So NCLEX can give you options like that, involving the family member. Yes, involve the family member. Right. You see, we've talked about the client, we've talked about the family member. Now let's talk about the type of advanced directive, and let's talk about this guy in particular. That is the durable power of Anthony healthcare president. We'll talk about the nursing duty. Okay, I'm missing something, but let me talk about that now because I'm missing now. The last thing I wanted to say is now the client have advanced directive. Now the NCLEX is telling you that, oh, the client have what? Advanced directive. So now what do you do to the advanced directive? You do two things. You document it in the medical record, right? And then you inform the healthcare team, right? So that's the two things you do with the advanced directive. Okay, there's another one as well. So you want to advocate, you keep on advocating for everything that is on the advanced directive. So now, which brings us to type of advanced directive. Now we have living will. That's a paper document, living will. Then we have a person that can either be the durable power of Anthony or healthcare person. Then we have our DNR, do not resuscitate, DNI, do not intubate. Right. So now, this is very important. This is the most important document. If the client have a living will, right, this guy right here must respect the living will. Right. Any information that is on the living will, this guy right here must respect. If there are some clients that are going to just have the living will. Now, let me just expose you to real life scenario. There are some clients that we just have the living will, and there are some clients that we have both the living will and their durable power of Anthony or healthcare prison. Right? They can have. Now, this is the problem. Most students don't understand that when there's a living will, this guy must respect the information in the living will. The only duty of this guy is to make sure that nobody go against this living will or explain the information in that living will to be clearer to the nurse and the healthcare team. Right. But the durable power of Anthony or healthcare policy cannot say, oh, I'm the durable power of Anthony. So the clients have this information right here, but no, I don't want the clients to have that kind of treatment. No. The durable power of Anthony cannot say or tell us to do anything against the living will. We expect the durable power of Anthony to respect the living will of the client the same way we are going to respect the living will. The durable power of Anthony should wash us that we don't go against the living will. That is what you want to understand. Also, if the client don't have living will, some clients will not have living will and they're just going to have what? The durable power of Anthony healthcare prison. Now, so now there's no living will. Now the durable power of Anthony healthcare prison can now make decision themselves for the client. They can decide to do anything they want now because there's no living will. But if there's a living will, the durable power of attorney must respect it. But now there's no living will, they are free to make decision for the client. Right. So uh do not resuscitate is very straightforward. Right. Or do not intubate is just when the patient is dying, don't do any kind of thing to resuscitate the patient. But the patient maybe have difficulty with maybe feeding, maybe they need airway, all that kind of stuff, don't intubate. Right. So it's as simple as that if the client have that. So yes, that is the clear understanding of this document. The living will, the durable power of attorney, do not resuscitate, do not intubate. So that's what you want to know for that. So let me think about other things that can be involved. Right, we expect the nurse to advocate if the doctor is trying to do anything, you know, right, against the advance directive. You advocate, right, for them not to do it. Now, there's also a particular scenario whereby maybe you saw the nurse and the healthcare team, or maybe you saw the healthcare team um performing resuscitation, right, to the client, and then you knew that this client have what, a living will, that, or they have do not resuscitate order, right, they don't want to be resuscitated. Immediately you notice this scenario, NCLEX can tell you what are you going to do. You need to inform them and tell them immediately the client have what, do not resuscitation, right, do not resuscitate. So they need to stop immediately. Right. So that would be the answer. Yes, that's one thing. Now, if there's conflict between the advance directive information, the nurse, the client, and the client family member or spouse, a loved one, they are saying, "Oh no, I know, I want my son, I want my husband to do this particular procedure. They need to be resuscitated, but the client have what, a living will, do not resuscitation, right?" And they say they don't want it. You as the nurse must advocate for what? The living will. You must tell the family member that no, I must respect the order. But if the NCLEX is saying you inform the family member that you must respect the living will or do not resuscitate order, and then the family members still insist, then your next step of action is to inform what? The ethical committee. Now understand the question very well, right? So that you don't make mistake, because a lot of students make mistake here. One is there's no issue, right? The family member just say they said, oh no, I don't want, I want my son or I want my husband to be resuscitated. But you inform them and you tell them, I'm so sorry, I need to respect the client advance directive. Fine, that would be a cool answer. But if the NCLEX is not saying, after telling them, they still insist that you must do what they want, then this is your next action. Ethical committee. Right. You might see answer related to ethical committee. Right. And you are going to see a particular answer to inform the family member that you must respect the client's advance directive. Don't jump yet to ethical committee except if you can sense conflict in that option. In a sense that the NCLEX will tell you, oh, you've informed them and they still insist. Something related to that. Right. That's what you want to know. Now, remember all these things. We don't obtain, the nurse don't obtain advance directive. We don't notarize advance directive. It's the legal team that notarize advance directive. Our duty is to document the advance directive in the medical record and to inform the healthcare team about the advance directive. So this is our duty. Right. It's good to involve the client family member, right, in their care. Right, it's very important. If you see that on the NCLEX exam, select that particular answer. Right. So yes, um, it's not necessary to witness the advance directive. Right, it's not necessary because they think that the doctor and the legal team can just do. Right, the legal team is already there. So yeah. So if you see answer related to that, NCLEX most time used to combine it with notarize, but we don't notarize, right? We don't notarize. And also NCLEX can also test you on some certain thing. A lot of people overthink on the NCLEX exam. Now NCLEX can tell you a patient who is mentally ill, let me just say mentally ill, they have advanced directive. Now, NCLEX can tell the family member that you will not perform emergency care. Now, you can see this statement. Tell the family member that you will not perform emergency care. Now, you can see the answer is very tricky, right? But the NCLEX, any answer on the NCLEX exam that you are not seeing anywhere in the question that is telling you why this answer will be the answer, don't select it. Don't fall for that NCLEX trick. Now, tell the family member you will not perform emergency care. Yes, NCLEX is just trying to test you. Do you know about advanced directive? Now, do you know that advanced directive include the care they want and don't want? Advanced directive include the care they want and don't want. So there are some certain emergency care that they might say they want it, and there are some certain emergency care they might say they don't want it. So right now, if you select this answer, you don't know what is in the advanced directive, because the NCLEX just they only said advanced directive. They are not telling you the information in the advanced directive. An advanced directive include what? Living will, durable power of attorney or healthcare proxy, and your DNR. So now, since you don't know what is in the advanced directive, whether it's they have a durable power of attorney, whether it's a living will, why do you want to do this, knowing fully well you don't even have an information in the advanced directive? The NCLEX just tell you that they have advanced directive. So this answer will be wrong until the NCLEX is telling you what is in the advanced directive. That is when you can select this answer. So don't make mistake on the NCLEX exam, right? So yes, this is everything about advanced directive. Right, this is everything about advanced directive that you need to know. Right, and trust me, if you have this information locked down, you will be able to answer any question on advanced directive correctly. So yes, this is what you want to know about advanced directive.